Oh, hello there. Hello nurses and hello world. This is nurseniezl and welcome back to my channel. This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the Osce examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, you are right. According to the thumbnail of this video, we're gonna discuss ankle sprain. Are you ready? Let's go. Okay, just a quick overview regarding sprained ankle. A sprained ankle is an injury that occurs when a person roll, twist, or turn their ankle in an awkward way. This can stretch or tear the tough bonds of tissue or the ligaments that help hold the ankle bones together. Now, these ligaments help stabilize joints, preventing excessive movement. So, a sprained ankle occurs when the ligaments are forced beyond their normal range of motion. Most sprained ankles involve injuries to the ligaments on the outer side of the ankle. And of course, I would like to talk about the treatment for a sprained ankle depends on the severity of the injury. Although self-care measures and over-the-counter pain medications may be taken, a medical evaluation might be necessary to reveal how badly sprained the ankle and to determine the appropriate treatment. I put this information here for just a quick overview what the sprained ankle is all about because there's a connection as we discuss it later on. Before we head into it, I'm just gonna give you a quick briefing. So you will be given a scenario. It doesn't matter what kind of scenario were given to you as long as you follow the marking criteria. As we all know, marking criteria is the Bible for your Osce. And it's the only way for you to pass the Osce exam if you follow the marking criteria. But don't worry, as we go along through each and every topic, I'm gonna flash you the marking criteria for you to study. Still, if you wanna know more, you can go to the NMC website, okay? I'm gonna flash it here in this screen. Again, it's a silent station, so all you have to do is, yes, right. First of all, you are given 10 minutes for this procedure. So before I start today's topic, I would want to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Oh yeah, more or less I'll be posting on the membership site in which I will give you more of the answers. So if you want to get all the answers, please do click the join button and become a member. So all your questions will be pop up to the top and I'll be able to answer your question as soon as I can. Okay? As soon as I can. Life is really busy at the moment. Okay? Anyway, let's go back to the topic. Alright, let's start. So first of all, what we're going to discuss today is about ankle sprain. And we're going to do an evidence-based practice station regarding ankle sprain. So, how are you going to write? First of all, let me show you the marking criteria coming from the NMC. Take a look. So, this is where you're going to get the marking criteria from the NMC. UK.org. So finding the table of contents, just go directly to the evidence-based practice scenarios and there you have it. You're gonna find ankle sprain in there, and this is now, nurses, the marking criteria that I'm talking about. Follow this one. So as you can see, there's a lot to remember, but you have to learn this by heart. You have to memorize this and learn this by heart. So it's too much. There's about how many? 15 of these? evidence-based practice, and there's what? Almost 15 professional values. There's just too much to memorize and to learn, isn't it? However, let me show you how you could learn it and memorize it by heart, okay? How about we make some keywords out of this, yeah? Because these keywords will help you remember this. So this is the marking criteria. How about we highlight the keyword? So the first one we've got here is, how about we highlight this part? Equally effective analgesics. Will that do? Yeah, how about number 2? We can remember to write this if we memorize the word clinicians prefer ibuprofen. You could just add other words after clinicians prefer to prescribe ibuprofen. How about the third one? Can we use this one as a keyword? That paracetamol is an effective analgesia? And then we could just add some words from the marking criteria. But this is the keyword for that, for you to remember. Okay, next one would be, yes, you're right, ibuprofen has more adverse effects. And you can also make this one as your conclusion. The last one, you can just put asthmatics. Remember this word, asthmatics, use paracetamol or asthmatic, and then paracetamol. Okay? Alright? Are we good? Okay, so nurses, shall we start writing? Alright, I'm gonna give you 10 minutes. You can pause this video and then write your answers. Alright, time starts now. Oh, you're back too soon. So you are here to learn what to write in this scenario, which is ankle sprain, an evidence-based practice station. Just a disclaimer, I'm not saying that my answers are right, okay? I'm just saying that when I go to the exam, this is probably my answer, okay? These are the answers that I have come up, okay? This is just my opinion. You are entitled to your own, okay? So I'm just showing you how it is done. This is now the scenario for your ankle sprain evidence-based practice station. You will have a patient named She, and he acquired an ankle sprain. The patient will ask you if which analgesia is better. Is it paracetamol or ibuprofen? You will be given a research study that is related to this scenario. You will be given an answer sheet that looks like this. So you can write here the relevance of the findings of the research and what advice would you give to your patient. So you have to write your responses on the answer sheet in a bullet points. So let's start. Number 1. So summarize the findings from the article summary, and you have to draw your conclusions, and you also have to make your recommendations. Always write clearly and legibly. Do not write about this. Just do it. Just write clearly and legibly. You don't have to make this as your answer. So for this one, I will inform, again, in the marking criteria, it says C or XI. I will inform Mr. She that both ibuprofen and paracetamol are equally effective analgesia or painkillers. Number 2, I will explain to Mr. She that some clinicians prefer to prescribe ibuprofen over paracetamol, but there is no concrete evidence that ibuprofen is superior. I will advise Mr. She that according to the current studies, that in pain resulting from soft tissue injuries, paracetamol is an effective analgesia. And then I will explain to Mr. She that even though ibuprofen is safe, it can have more adverse effects and can be contraindicated in patients with bronchospasm and renal and cardiac failure. In conclusion, I will recognize that Mr. She is asthmatic and that paracetamol will be suitable for him. So how did you find it? Was it easy writing one? Again, if you have any doubts, go to nmc.org.uk for you to know more about evidence-based practice. I hope you learned something for today. If you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more Osce videos, then hit the notification bell. Join us and become part of the team. This has been nurseniezl. See you on the next one. Bye! now we've come to our shout out section. Shout out to Cian Smith. I hope you found what you're looking for. Welcome to the team. Congratulations to Priya Lukosi 2746. Welcome to the register. Congratulations. And we've got a new member. Welcome to the team, Christy Corpus. Thank you, Travel with Manu, for joining us as well. Welcome to the team.